Good morning, everyone. Thank you for joining us today for this panel on relief, recovery, and peace in the context of climate change. My name is Khanal. I'm thrilled to be your moderator today, and I have an exciting lineup of panelists and speakers that will join you for the next hour. We live in a world of overlapping disasters and escalating conflicts. Many of the same countries that have ongoing conflicts and natural disasters and climate-induced disasters are the same. The same countries that have ongoing conflicts also are at the front lines, are also the front runners of being impacted by the climate crisis. And I can talk about this being from Nepal. You also saw Nepal being featured earlier in the video. We've been hit by armed conflict, natural disasters, floods, earthquakes, climate-induced emergencies, new disease outbreaks, and like many countries that are facing these dual crises, we are also least prepared to deal with the shocks and stressors of climate change. So to discuss sort of delivering health services and building sustainable climate resilience in fragile states and conflict zones, we have an incredible lineup of speakers. Our panel scope is broad because the challenges are also daunting. This requires us to, sort of reach beyond our individual fields of expertise and learn from each other. This compels us to dig deeper and extend our arms in collaboration, and that's why we're here today. Our panel scope and our panel's goal is threefold. First, we want to deepen the understanding of climate's impact on fragile states and conflict zones. We really want to hear about the very real challenges in these places. Second, we want to talk about the need to break the barriers and silos for integrated health services. We will learn from the work that our panelists do. And third, we want to start identifying essential solutions and collaborations. How do we come together to address these health and humanitarian needs where it is most needed? So without further ado, let's turn to our Firestarter, Professor David Smith. Professor Smith joins us from Jamaica. He is the coordinator of the Institute for Sustainable Development at the University of the West Indies. He's the director also of the Center for Environmental Management. David's work spans disaster risk reduction, sustainable development, and enhancing climate resilience in small island developing states. David has pioneered initiatives like Jamaica's first Debt for Nature swap. Let's welcome David Smith. He's joining us from Jamaica on screen. The floor is yours.
Thank you very much, Anu, and thank you to everybody for inviting me. I'm going to share a perspective from small island developing states. These states are found in the Caribbean, in the Pacific, off both coasts of Africa and in the Indian Ocean. And I'm hoping lessons that we have learned and our experiences will be relevant to many of you, particularly those countries in the tropics. This picture is just to illustrate the perils of living in zones which are exposed to climate hazards. In this particular case, you see 5 tropical cyclones passing through the Atlantic basin. 3 of them are already in the area of the Caribbean, 2 of them are waiting to come in. And this is the nature of living in a hazardous zone, that we're not necessarily talking about just one hazard. Often the hazards come by one after another. Often before you've had a chance to do anything about the first time you've been hit, then something else comes along. Within the context of living, though, in small states and striving to achieve the Sustainable Development Goals, we cannot avoid the climate effects. Climate change is already happening, and our response has to be adaptation. But climate is changing sometimes beyond our capacity to adapt. We know that economic output in our countries can fall by as much as almost 2.5% for every degree in temperature rise. And climate will affect goal 2, which has to do with providing food, and goal 3, which of course has to do with health. At the same time, we have a shortage of human and financial resources to solve the problems, to do research into figuring out what's the best way to address those problems, and even after we know the solutions, to actually do the implementation. We would like to transform our economies to green economies, but there are several constraints, including the constraints that have made us in the situation of being less developed countries in the first place. And within this context, within this background, we have to try and deal with the fact that we are suffering from coastal erosion due to sea level rise. And much coastal infrastructure is vitally important. It's our ports, it's our roads, it's our airports. In addition to that, you'll see situations where underground water reservoirs, if you pull out too much water, sometimes that gets replaced by seawater and not fresh water. There's, of course, the effects of climate on health, and I'm sure we're all familiar with vector-borne diseases, and we're particularly aware of things like malaria, dengue, and Zika, as we saw in the video just earlier on. But there are neglected tropical diseases, waterborne diseases, gastrointestinal problems that sometimes appear after floods, as colleagues in Fiji have pointed out in research we're doing at the moment. And then there's just the effect of heat and how that might affect people who have to work outdoors. That leads to the point that climate is not the only thing that we have to worry about. We're subject to earthquakes, volcanoes, floods, epidemics, and slow onset problems such as droughts and dry periods. This leads to stress, forcing people sometimes to migrate. And of course, there's always the problem that while you're recovering from the first hazard, another one will hit while you're recovering. In addition to that, we're looking at things like increased ocean temperatures, increased ocean acidity, which leads to ecological problems such as the coral reef tipping point or the loss of coral reefs in the tropics, with its potential effects on fishing and tourism. Also, one other thing to bear in mind, even though most of us are not in countries which are actually in conflict, that doesn't mean that we are without serious problems in terms of social resilience. 14 of the world's top 20 countries in terms of homicide rates per capita are Caribbean small island developing states, according to the UN ODC. And 3 of those states are in the top 20 in terms of actual numbers of homicides. We need to consider as well inequality. Tropical countries get affected first by many aspects of climate change, in most cases long before countries further away from the equator. But for all countries, even the well-off ones, there are many communities which are poorer and are going to be much more affected by the hazards that we experience. And while we keep our minds and our attention is sort of grabbed by tropical cyclones, slow onset hazards such as drought or simply getting warmer and warmer every day are also vitally important and may have as much of an effect as the sudden onset hazards that we experience. We need to bear in mind as well that vulnerability is multidimensional, as we know from the recent release of the Multidimensional Vulnerability Index from the United Nations. But importantly, vulnerability does not decrease as your GNI or GDP increases. Vulnerability is with you all the time. And bear in mind, as I said before, another hazard might occur while you're recovering from the first hazard. And what does recovery mean? Recovery is getting back to where you would have been had the first event never occurred in the first place, not simply getting back to where you were the day before the event took place. And that takes a long time. Possible solutions. There's the example of the road to the airport in Samoa, which would have been normally repaired by government funds, but they were able to take government funds and marry that with climate funds to make the road more resilient and to increase the chances that it would withstand the next event. We are seeing within the private sector, particularly, increased use of things like solar and alternative energy. But there's also a need to work with the private sector and train particularly small and medium-sized businesses and entrepreneurs on how to become more continuous in their business, how to reopen as soon as possible after an event, how to deal with the problems we're now seeing. On another level, we need to follow through with the loss and damage pledges which were begun at COP. Unfortunately, those of us living in the tropics and in small island states are a little cynical about pledges made at COP because we've seen many, many pledges, but often countries don't follow through to the extent that they should be in terms of meeting those pledges once it comes time to actually start putting money into those funds. We need to look at the sources of development finance and existing loans and make sure that they include climate change adaptation and also use the Multidimensional Vulnerability Index and GNI to determine eligibility for concessional funding, concessional overseas development assistance. This is very important because many countries look prosperous on paper and therefore aren't available to get the funding that they need to do proper adaptation to climate change. And we need to build resilience and reduce risk all the time, not just after an event, but preferably all the time before the events take place. We need to bear in mind that engineering won't solve everything, but is vital. We, in order to solve the problems that we're looking at, need research and access to research. So a lot of research is hidden behind paywalls. We need to be able to break those down and make research increasingly more available to scientists and policymakers and people who are doing the action within tropical countries. And we also need to look and see how well our lifelines, our hospitals, and key economic installations are in terms of what is likely to take place. So to summarize, climates are already changing in tropical countries, and the changes will occur beyond our capacity to adapt. We need to do more research on the effects of climate, and the existing research needs to be accelerated, needs to be better funded, and we need to have access to the fruits of research and research papers in other countries as well. Let's remember that most SIDS and most tropical countries are subject to multiple hazards, and we should not neglect the less spectacular, the slow onset events. We need to address vulnerability and inequality, and that goes beyond the health sector alone. And also let's remember that recovery takes longer than you think. I'd like to leave 3 questions for the rest of the panel. For the first is, what actions can we take in the short term to improve the readiness of health systems in the tropics for the increases that we are already seeing in terms of climate-related health issues? How can relief and development agencies support preventative measures, risk reduction, and building resilience, as well as doing the relief and recovery that they're already working in? And how can international partners address slow onset events such as increased heat, epidemics, and water shortages? Thank you very much.
Thank you, Professor David Smith. He left us with some compelling questions as well as a question to the international community on how do we go from pledge to action, how do we go from commitment to delivery, and how do we move from intent to impact. Thank you, Professor Smith, for staying up so late and for sharing lessons from small island developing states that are applicable to all of us. Now, as I invite my esteemed panelists to join me on stage, I want to talk about the panel. Our panel today steps out of traditional boundaries. We bring together trailblazers from across across the spectrum of humanitarian assistance, health systems, research, policy, and sustainability. These individuals and their organizations are dedicated to addressing some of the planet's most pressing crises, whether it's wars, natural disasters, epidemics, and other health emergencies. They're active in overlapping regions and countries. They're providing care and supporting communities facing repeated disasters, displacement, and conflicts. I want to thank them for being here with us today, and I'll do introductions of our panelists. So first off, to my left, we have Neil Vora. Neil is a physician at Conservation International. He focuses on pandemic prevention and the One Health approach, linking human, animal, and environmental health. His experience includes significant roles in managing responses to major Ebola outbreaks and leading New York City's COVID-19 contact tracing program. Welcome, Neil. Next, we have Anne Canavan. She's the Senior Director at International Medical Corps, bringing over 27 years of expertise in international development, specializing in climate-sensitive programming in transitional contexts. Her leadership in enhancing health system resilience in conflict-affected regions is critical. Next, at the end of the panel, we have Stephen Cornish. Stephen has successfully negotiated humanitarian access to vulnerable populations all around the world in conflict settings. He has also played a lead role resolving aid worker abduction, crisis, and other emergencies. And last but not the least, we have Baltica Cabieses. Professor Baltica is in Chile and is joining us from there. She directs the WHO PAHO Collaborating Center on Health Capacity Building for Migrants and Refugees, and is a founding member of the board of Lancet Migration Latin America Hub. Welcome to all of you, and thank you for your time today. I would like to jump in and go right ahead to the panel. And Stephen, if I could start with you and ask you about, we're really keen to hear how climate has added to the urgency, challenge, and complexity of the work that you do. How are you going about with these new challenges in place?
So it's so great to be here, and thank you for the question. And just like we just heard from Professor Smith on these repeated incidences, this is now what we're seeing is a cycle of things that are affecting communities one after the other, really affecting their ability to cope, to recover, and to remain resilient. In Mozambique, for instance, we saw 2 back-to-back storms which destroyed villages, knocked out health systems. And it's not only the storms, because each time there's a climactic event, we then see the rise of vector-borne diseases. We see cholera or malaria. In Mozambique now you have malaria peaks all year long. And then this leads to difficulties in nutrition, in water and sanitation, etc. We've seen the same this past year in Chad. After 3 successive years of very significant droughts and large hunger gap periods, they were then hit with an enormous flood. It rose their river levels by up to 8 meters, causing 500,000 people to be displaced. The land was so waterlogged that they couldn't then return for planting season. And staying in the camps too long, then you have the emergence of disease and the cycle repeats, measles, cholera, etc. And Chad is now also hosting 700,000 refugees from the conflict in Sudan. So we're having to change our approach to be much more preventive, to work on the front line with community health workers, giving them the diagnostic techniques to be able to identify things like cholera, like malnutrition, malaria at a very early stage, and only put us in referral. We're using forecasting tools so we can pre-position supplies where we believe they'll be needed most. Supplies are very limited. And we're training local community members and working in partnership so that the communities truly can be and continue to be the first line of defense and resiliency as they've always been.
Thank you, Stephen. The collaborations are already happening where humanitarian agencies are moving beyond humanitarian work to long-standing sustainable work. And with that, I want to go to Anne. Stephen touched on this, strengthening health systems in conflict and fragile zones is by no means easy. How do you go about ensuring that health systems withstand climate hazards, and what are you guys doing in this space?
Thank you. And really building off the discussion about positioning for health system resilience in such low resource settings where countries, ministries of health, and communities at large are faced with these mounting tasks of response to displacement, coupled with natural disasters, and now compounded further by climate threats and hazards. In terms of health systems resilience, I would frame it around as a starting point, the WHO Health Emergency and Disaster Risk Management Framework. It speaks to all of the elements that we need to pay attention to, starting with comprehensive risk assessments. We're talking about an all hazards approach, clearly, moving to looking at an inclusive approach with communities, considering also the systems approach, and really importantly, looking at it from a perspective of how we can resource and capacitate health workforce, of course, which is really at the center of this. Starting with the comprehensive risk assessment, we have a lot of these assessments that go on, and many of you are familiar with the plethora of tools and resources that we have at our disposal. In terms of climate, I think the good news is that we're actually at a point where we can integrate and optimize some of these tools to actually reinforce and to deepen our appraisal of vulnerability and risk, particularly in relation to the risk profiles that we're working with in terms of climate hazards. So, for example, we use multi-sector needs assessment tools and optimizing that further through AI-assisted applications and so on that allow you to get to that granular level and really assist communities affected and communities at risk. That obviously is just one part or one dimension of what we need to be doing. Secondly, I would say we need to be looking at the health services that are available in these very overstretched resource environments do not have the capacity to bear with additional burden of disease. They often have major gaps in terms of health workforce. So what are we doing about it? I think this is where we need to talk about solutions. Essentially, there's a real need for both pre-service and in-service support that specifically tailors the education to the climate hazards. We're talking about acute situations where you need mass casualty management, where you need basic emergency care. This is some of the work we're doing, and many of the supporting non-government agencies are doing in collaboration with WHO and the ministries in various contexts. In addition, however, we need to address the chronic disease situation, so we're looking at the exacerbation of pre-existing conditions like cardiovascular diseases, respiratory diseases, many of which were mentioned here today already, that populations are further disposed to and predisposed to. This is clearly something that is a major gap for health workforce, health providers, community health workers, that we need to address. Some of this we're doing through basic 101 type curriculums that are accessible in various languages that we are developing in collaboration with ministries of health. They need to be really succinct, comprehensible, intelligible for the local community, often in relation to literacy levels and so on as well. Stepping that up, what we need to do more is actually really seriously look at the health workforce in terms of professional development around climate hazards and response capacity. Building that in, as I mentioned, to pre-service, as well as ensuring that the reinforcement of continuing education is there. And it doesn't stop there, of course, with capacity, because thirdly, you need more resources, you need more supply chain, and of course the forecasting models that need to be in place to actually ensure that those supplies are available. We work a lot with interagency health kits, and the mass casualty management requires surgical kits, as well as stabilization and first aid supplies. These are some of the aspects that you need to pre-position in acute emergencies, but what happens when it comes to chronic diseases and supplies that are needed in displaced situations? So more work needs to be done there, clearly, but as I mentioned, I like to focus on the positive here. There are some really there's significant capacities already built in emergency contexts that can now be further capitalized on and reconfigured to ensure that we integrate the response to climate. I'll leave on that positive note.
Thank you, Anne, and thanks, Stephen. You know, it's really encouraging to hear that there are new tools, new technologies, a lot of collaboration happening in this sector. But going back to the very nature of emergency and crisis, you know, there's a lot happening on the ground. Things are moving quickly. Can you share with us some examples, sort of real time, of how this plays out on the ground, and some of the ways that you've been able to integrate sort of the best practices you've talked about and some of the tools to help inform these decisions? And Stephen and maybe you guys could each take this question in terms of sort of examples to ground this in very challenging circumstances.
Mm-hmm.
Well, I think talking about Eastern Chad and Sudan then would be very apropos. In Eastern Chad, we haven't seen the outpouring of funds or the arrival of international organizations to the scale that's needed. And perhaps necessity is the mother of invention, but this has pushed us really to work much more with small grassroots associations that have grown up around the different impacts for the communities. And these associations have then followed the refugees into Eastern Chad. So we're working with them, helping do the supplies, helping do training, really doing everything we can to help build the resiliency into those organizations. In the health system itself, we do the same. We've outfitted the health posts with solar panels, with water, with electricity, communications, everything that they'll need to be resilient offline. So there are a number of positives, but the reality is the situation is so overwhelming. We are using mapping and a number of different technologies to try to provide adequate drinking water. But this is now a real challenge because it's overtaxing the aquifers, and we're having to make decisions on, do we reduce the amount of water per day and end up with disease burden, or do we increase the liters per water per day as recommended by emergency threshold, and then potentially have the aquifers lowered too much or even run dry, which would then create problems between the community, the hosting community, and the refugees. What we've really seen and been very enthused by, though, is both the open arms of the Chadian people and government in receiving these refugees, the communities who have brought them in many places. You have 5,000 community members and you have 20,000 refugees. So this does lead at times to conflict and disagreements, but what we've seen is the attempt to be able to give small plots of land, to be able to give certain rights, so that people can truly start to become actors in their own care and not just be reliant on the international system. This does prove and will provide challenges over time, and there's an area where many of the lessons that we've learned from a long time ago are still not put in place. There's no clean cooking fuels being delivered by anyone, which then is going to exacerbate tensions on the local environment, leading to deforestation and other types of conflict. At the transit camps, we don't even have the minimum like shelter or care for the vulnerables. So the situation is really overwhelming, and I do fear that it's really a harbinger of things to come if we don't step up our partnering, if we don't step up to the needs that we are seeing and to the scale and the urgency of the matters at hand. We have many little solutions that we're piloting, but really we're having enormous difficulties in scaling them across all of our operations.
Thank you for that, Stephen. And with that, maybe I will transition to Baltica for a minute. Baltica, you've worked a lot with migrant populations and, also on displacement. Talk to us about sort of the challenges that you see in these populations as an effect of climate change, and what have you seen as being successful in overcoming these obstacles to ensure that their health and safety, is considered as primary?
Thank you, Anu. It is my pleasure to be sharing this panel with all of you first. I want to begin with the idea that human mobility, that is the movement of individuals, communities, and populations, is a well-recognized determinant of health and well-being globally. The movement of people is also not necessarily a crisis. It is a part of a human behavior, and it has been since we exist in this world. However, when migration is due to drivers that involve force, compulsion, or coercion, it becomes a crisis. Many authors in the past 70 years have documented the role of migration on health, highlighting its impact on economies and population dynamics. Its relationship with climate change, however, is far more recent. For individuals and families who are forced to leave their homes due to economic, political, social, climate, or health reasons, these conditions are affected by certain forms of structural violence, including but not limited to their legal status, exposure to an experience of xenophobia and discrimination, social, cultural, linguistic, administrative, and financial barriers to health care, barriers in access to health information, variable health literacy, and fear of detention and deportation, to mention a few. Today, the interconnection between climate change and human mobility is well established, and the effects of both on population health are growing rapidly. This generates the mobilization of people from their houses to safer places, as it has been already mentioned by our wonderful panelists, within the same country or across borders. For example, Rio Grande do Sul in Brazil was hit by historic floods a few weeks ago, generating regional and international commotion. An entire rural village was mobilized by boat as a result of this natural disaster associated with climate change. The experience of climate change migration is a relevant and urgent global crisis. A crisis is a turning point representing intense difficulty and uncertainty. Crises may occur rapidly, or they may develop slowly over extended periods of time with subtle manifestations. A crisis' visibility or invisibility is a key determinant to the nature, extent, and distribution of its impacts. Gaps in evidence today show a disturbing trend of portraying vulnerable populations as invisible, with urgent action of their visualization and recovery. This was also highlighted by Professor Smith. Recommended approaches to protect the health and lives of climate-related migrants are largely based today on human rights, providing the right conditions for them to adapt positively to adverse experiences, include ensuring their basic needs are met, providing trauma-informed care, and ensure a holistic, nurturing environment for them. Among migrant youth in particular, that is the intergenerational recipients of our doing in climate change, migration, and health globally, it is recommended also to protect the process of identity construction, which often requires intersectoral work and significant skills in mental health, as well as sexual and reproductive health. Intersectoral action is crucial, along with raising the voice of climate, migrant, and refugee communities to understand better what they need, how, and when they need it. I will end here for now. Back to you, Anu. Thank you.
Thank you so much, Baltica. And all of you mentioned sort of the importance of intersectoral collaboration. And I want to ask Neil about how how can efforts across humanitarian, health, and environmental sectors be integrated to address the interplay between climate change and fragility and conflict?
Thank you. It's an honor to be here and to be learning over the next 2.5 days. And my professional experience as a medical doctor and epidemiologist in working in a variety of settings has confirmed for me what the science shows, which is that human health is inextricably linked to the health of animals and the planet. And that's why I'm so glad that there is this growing climate and health movement. I know that many of you in the audience have been instrumental in making this movement happen, and it seems like last year we hit a tipping point. The first ever Climate and Health Day at a COP, a declaration on climate and health signed by over 140 countries. These are monumental achievements. But I do have one concern, that nature is not being brought into this conversation on climate and health nearly enough. We are not going to meet our climate goals without nature, and if we don't meet our climate goals, the human health impacts will only be so much worse than they already are. We would have blown past the 1.5 degrees Celsius threshold were it not for nature. And so we have to start investing more in nature, and that's my call to action for all of you today. Think about how you can bring nature into this growing climate and health movement. And oftentimes when we talk about nature-based solutions to climate, people think that nature only has a role in mitigation, but that's not true. We need nature for adaptation as well. We've talked a lot today about waterborne disease and access to clean water. Well, nature provides many communities access to clean water. We've talked about natural disasters. Well, nature helps protect communities from natural disasters such as cyclones. And so nature is a fundamental part of what we are trying to accomplish. We're not going to meet our goals without nature. And when done right, conservation helps us to achieve health equity. When done right, conservation benefits everyone everywhere, particularly communities in some of the most resource-limited settings of the world. And so just to tie this up, I want to just end this comment on a message of hope. I've only been in this world of conservation now for the last 3 years, and I have never felt more hopeful for the state of the planet. There are so many amazing examples of win-win scenarios for people and planet, so let's take advantage of this golden opportunity.
Neil, expand on that a little bit in terms of win-win across sectors. Are there examples that you've been a part of or have seen that are effective, could be lessons for the rest of us?
One example I would point to is Health in Harmony. So this is a nonprofit organization that maybe around 15 years ago started working in Indonesian Borneo. And they employed this model called radical listening to help support communities in saving rainforests. And communities reported that deforestation could be prevented if communities had better access to health care and better jobs. And so this nonprofit supported communities by building a clinic and by conducting alternative jobs training. And a decade later, the results were incredible. Infant mortality dropped by 2/3. And at the same time, rates of malaria, TB, and diarrheal diseases also decreased. But meanwhile, deforestation rates also dropped. The number of families engaging in logging decreased by 90%. So that's just one example of a win-win scenario. And we have to remember that the best custodians of natural ecosystems around the world tend to be indigenous peoples and local communities. Over 80% of the world's biodiversity is on lands and oceans, or lands and waters managed by indigenous peoples and local communities. These are the peoples that understand how best to protect nature, and so we need to be supporting their solutions for nature.
Thank you, Neil. Stephen, do you want to add to that? I know Health in Harmony and MSF work on this jointly, and you've both had to step out of sort of the natural work that you do to encompass something broader.
Yeah, no, I'd love to. I'd love to talk about those tensions in partnership as well as the new tools, because I think we need both in order to change how we respond so that we'll all be fit for purpose in a climate-affected world. And Health in Harmony and ourselves are working in Madagascar in harmony together. This approach of radical listening means that you really spend much more time with the community in integrating the health solutions as they see fit, and not necessarily in the order that a doctor might prescribe of what might seem most important. Trying to build the health solution then at also a level that's sustainable. And meanwhile, with our partners, Health in Harmony, and the local partners on the ground, they're then working on both natural restoration as well as improving livelihoods. And when we also add strengthening the health system itself, the hope is that over time, what we'll see is a stronger, more resilient community, better able to stand up front of the storms and the other incidences that will occur. But we also need new tools in the toolkit. And often new tools can be quite scary. In Honduras, in Tegucigalpa, we're together with the community and the Ministry of Health trialing Wolbachia, which is a mosquito that has a gene that doesn't allow it to carry dengue and a few other arboviruses. But we've seen in other places, communities and organizations shy away from these new types of technology. In this case, through a very long process where we interviewed over 10,000 community members, we've had full pickup. This Wolbachia is still very expensive, very hard to implement, and hasn't been trialed at such a large open setting. So our hope is that with the community and the Ministry of Health support, that we'll be able to find ways to reduce the cost, to make it more appropriate. And in the end, this would reduce spraying, which we often still rely on in the humanitarian community, which can have impacts on the natural world and polluting streams, killing small organisms in the food chain, and also having an impact on human health. So more and more we're trying to see how we can come up with a toolkit, how we can partner better, but we also have to remember, especially in conflict settings, we can't just rely on technology as sort of a technological fallacy, because technology can be turned off in several seconds. So we have to be able to have an analog system and technological benefit working hand in hand so that we can always restore and rely on the old-fashioned techniques, a doctor being able to prescribe without all of the tests, because otherwise we'd be rendered powerless. As soon as one opponent in a conflict wants the upper hand, they just turn the technology off.
Excellent. Love the collaborations and the exciting innovations such as Wolbachia. Thanks for sharing. And you know, you've talked about this a little bit, and this ties up nicely with the need for sustainability. The health workers are at the front lines, whether it's community health workers or former health workers, and you've done a lot of work in strengthening capacity of health workers. Talk about sort of that work in context to fragile and conflict zones, and why it's important and how you do it.
Thank you. Let me just position it in relation to the operational environment that these health workers find themselves in. So, for example, in Somalia, we work with the ministries, not just Ministry of Health, of course, but the government at large, to support emergency operating centres. They're EOCs, as they're called. The idea there is to actually have the operating environment ready, with inclusive of procurement, local procurement, supply readiness, and so on. That, of course, enables the healthcare provision in a time of disaster. That links, of course, to communities and community readiness. So really working with the communities to identify what are those enablers and how to really expand on the information education efforts that they're instrumental in providing. They're both effective, but they're also the first responders. And then going to the facility level and referral network level, where the efforts really are to invest further in capacity strengthening for the healthcare provision. Of course, you need all of that. You need your operating environment, your community first responders, and your health providers for the acute services, as well as preventive support. So that's the continuum we work in, typically in these contexts. The moment we're really looking at this as a kind of resilience pathway for health in about 14 countries, where we can actively support the ministries at the national, the decentralized levels, as well as the community local partners. So in addition to that, there's also a local NGO capacity strengthening for climate and health investment we're making to build their both operational and technical capacities, because really that's the legacy you want to see, that readiness at local level is number one in order to actually ensure that whatever disaster strikes or multi-hazard kind of situations, they have that, wherever possible, they have that local capacity.
Thank you, Anne. I'll turn to Baltica and ask, in this continuum, in terms of improving access to health services for displaced populations, where should investments be made, Baltica?
Thank you for this great question, and I hope you can hear me well. I assume you do.
Yeah.
Yes, okay. So there are a few examples of global action around climate change and health. In fact, as a part of our WHO Collaborating Center, we are trying to document as many as we can from all over the world with my colleague Alice Blukacs and some WHO colleagues. One unique case, again from Brazil, is one in which a program was created to strengthen the capacities of border municipalities in the Amazon to face the challenges of migration, climate change, and health. In this case, IOM, PAHO, and WHO developed this program with local authorities and the government. They deployed specific actions to climate migrants in such localities, in border communities, to effectively secure access to essential health services and to build capacity for healthcare teams to be at the point of care with climate change, migrants, and refugees. There are other some valuable examples, like this one in Jordan, Iraq, Lebanon, to mention a few. But we still need more good examples of where efforts and investment should be directed to improve access to health services for displaced populations. We must expand our ways to promote intersectoral collaboration, share our knowledge, effectively invest in cost-effective actions, and strengthen systems to make them climate and migration aware and resilient. In the meantime, some general insights from the social epidemiology arena, as well as adding nature to our toolkits, as mentioned here in this panel, would be this. First, to further discuss and generate global consensus around the concept and way of registering climate migrants and refugees and other similar categories of human mobility globally. Second, to protect climate refugees and migrants, particularly women, older people, and unaccompanied children, from everyday form of exploitation and violence. Third, keeping climate migrants and refugees' families together. Fourth, press for action on the underlying causes of large-scale movements of refugees and migrants, including climate change, of course. Promote measures to combat xenophobia, discrimination, and marginalization against climate migrants and refugees in countries of transit and destination. Increasing the quantity and quality of data about climate migrants and refugees. Provide safe and legal pathways for climate migrants and refugees to seek asylum and reunite with family, including protection from trafficking and smuggling. Ensuring no climate migrant is detained because of their migration status. And finally, strengthen national education, health, child protection, and social protection systems, that is, housing, community integration, cultural support and protection, access to adequate nutrition and hygiene for climate migrants and refugees without discrimination. Back to you, Anu.
Baltica, thank you for those policy as well as implementation recommendations. I also see a question on the screen that's directed to you, which would be happy if you could share virtually, Baltica. Are there research about refugees and migrants to increase lifespan, reduce mortality, mobility in the context of climate change? If you could share, we know you've done tons of research, so if you could share those research articles and publications on the virtual space, and we'll also share it in the room, that would be extremely helpful. We have one more question from the audience that I want to, Neil, if I could raise this to you. It says you've talked about disaster response, but how do you get in front of disasters by scaling new technologies for climate-sensitive disease, epidemic prevention, preparedness? It's your area, Neil.
Yeah, absolutely. So we absolutely must be investing more in pandemic preparedness and response. New infectious diseases have been emerging at an accelerating pace for the last maybe 70 years, and given ongoing environmental pressures, they're going to continue to emerge. And so we've seen with COVID, Ebola, Mpox, Zika, the list goes on and on, avian influenza, that we need to be ready, we need to be preparing, have better surveillance, better vaccines and medicines. But there's another technology that's already available at our fingertips that has been honed over billions of years, and that's nature. Surprise, right? But that's exactly what we need to also be considering, because a lot of this conversation on pandemic preparedness and response doesn't think about prevention. But infectious diseases are emerging increasingly because of human activities, such as deforestation, how we raised farmed animals in these industrial scale animal farms, how we are trading wildlife commercially in urban centers. And so these are aspects of human activities that we need to be thinking more about so that we can prevent the emergence of infectious diseases alongside preparing and responding to infectious diseases as they emerge. And this is fundamentally an issue of equity. When we prevent, everyone benefits everywhere.
What an important note to pause on. You know, prevention is at sort of the heart of the work that we do. And Stephen, I think you wanted to respond to it.
I'll just add on that, because now with forecast mapping, with using big data for past malaria curves, we are able, as soon as there's an event coming, to know exactly how many severe malaria patients we're going to have in the hospital, to be able to pre-position staff. We're also increasingly doing mass drug administration preventively. So we can start to react better rather than just reacting after the fact. And this then reduces resources, reduces suffering, and also communities' vulnerability by keeping them at a higher level. So I think there are probably other examples of that nature, and together we have to really be moving in that direction to keep really people and planet at the center. I agree fully with Neil. We have to get more preventive. We have to partner better, including public-private partnerships, but we really have to keep people and planet at the forefront of our thoughts.
Thank you, Stephen. Wonderful examples of sort of cross-fertilization, but also sort of efforts before something happens, before the onset. You know, the first Relief, Recovery and Peace Day at a climate conference of parties last year called for bolder collective action to build climate resilience at the scale and speed required in highly vulnerable countries and communities, particularly those threatened or affected by fragility or conflict or facing severe humanitarian needs, many of which are least developed countries and small island developing states. The goal of this panel today was to reflect on, you know, places where there is already a lot of problems and climate change is exacerbating those problems. You heard from a spectrum of actors, you know, who are not only doing the things that they're traditionally doing, but really expanding and becoming agile to take on more and to do it collectively. Sincere thank you to the panelists for your tremendous work. We are all huge fans of your work, and you work in very, very difficult situations. I invite the audience, both virtual and in the room, to continue this conversation on social media and to join us on day 3. And Canavan is co-leading a roundtable that will take the recommendations from this panel, but also add in input from the various communities of practice in this audience for submission to the COP29 Organizing and Advisory Committee. So I would like to extend an invite for everyone for the roundtable on day 3, and I want to extend my deepest thank you to the panel today and to Baltica on screen. Thank you so much. Thank you.
Thank you, Anno, and thank you for interesting discussion, dear panelists. And now, before we head out to lunch, another profile in climate resilience.
Geographically blessed with natural beauty, Bangladesh is also a very climate change vulnerable country. Recently, the country is facing more frequent extreme weather events. Its coastal region, Cox's Bazar, regularly endures torrential rains, landslides, flash floods, and extreme temperatures. In 2017, Bangladesh welcomed over 1.1 million Rohingya refugees fleeing persecution in Myanmar. Today, Cox's Bazar hosts the world's largest refugee settlement.
I started working with the Rohingya refugees back in 2017, and as I continued to work with this community, I came to realize that shelter is one of the major crises that is not only affecting the life of the people who are living here, but also a great concern for the government and other humanitarian agencies, and this needs immediate attention.
Initial refugee shelters, made from bamboo and plastic, offered little protection. Frequent disasters caused costly damages and harmful plastic waste. Poor ventilation and insulation led to high respiratory and heat-related illnesses. Searching a sustainable solution, Dr. Farjana turned Dr. Mubarak Ahmad Khan's invention made from jute and resin into robust, bio-acceptable and recyclable housing material, jute-in.
It is rust-proof and saline water resistant. But a very important property is it is heat resistant. Its low thermal conductivity keeps the house warm in winter but cool in summer. And due to its high tensile strength and durability, it is an appropriate housing solution for different climate vulnerable regions like Bangladesh.
Ia dora sur golibo bera siriore terfal phari jago fuande soinde phari sele ia yanola don nai hono do tornai aratu.
বাতাস বাইলে বৃষ্টি দিলে কালফাল উড়াই গেলে মানে জ্বর হইতো বৃষ্টি হতো ইয়ানোর মধ্যে অন্ন পড়ে
We constructed this house back in 2021, and till date, it withstood some major climatic disasters like extreme floods, cyclone like Mocha and Remal, and still standing in a good shape without any repair or damage. Now we are constructing more houses in other coastal areas of Bangladesh. We foresee a huge possibility to scale up this jute-based housing model in other climatic zones around the globe.
Ladies and gentlemen, now it's lunchtime. Lunch will be served in a bistro restaurant on the first floor. Enjoy your meals, enjoy your networking, and check your emails or take a power nap. But please be back here before 2:15. We'll have another interesting panel.